Good afternoon, everyone, and thanks for joining us today. Welcome. This is the last of the webinars that the Gaines Center is hosting for its crisis learning community. And throughout this learning community, we and various crisis response approaches, and we have explored alternates to law enforcement with in crisis. And so today we will be discussing the CIT ECHO program, exploring sustained mental health training and consultation responders and behavioral health partners. So I am Dr. Melissa Stein, a Senior Research Associate with Policy Research Associates and the lead for communications out of the Gaines Center. And I have just a few housekeeping for you. First, the views expressed in this presentation necessarily reflect the views of the Mental Health Services Administration or the U.S. Department of Services. Throughout the presentation, we welcome your questions. You can submit them in the Q&A pod, and of the presentation, we will address as many as possible. We are also excited to provide for you today an extended discussion time where you will have an opportunity to ask and have a more back and forth dialogue with our presenters on this. So we hope that you at 4 p.m. Eastern. This is recorded and the slides will be disseminated via the Gaines list. Make sure you're signed up for that. We're also able to provide live captioning to increase accessibility. And so in order to, you will want to click the, it'll either say accept or continue in the multimedia pod, which is the right-hand corner of your WebEx screen. To just briefly introduce our presenters for today, Dr. Niels Rosenbaum. He has worked in this department since 2007 as a co-responder, and he is the director of APD's Behavioral Sciences Division. He's also a volunteer in New Mexico, and he won NAMI New Mexico's Outstanding Psychiatrist Award, academic journal publications on mental health police call. Next slide, please. We also have Dr. Martin Gonzalez. He is a psychiatrist at New Mexico Health Science, specializes in the treatment of severe and developmental intellectual disorders. And he also has extensive experience in community psychiatry alongside law enforcement, including the Albuquerque Police Department's Crisis Intervention Team. Detective Lawrence Saavedra has been in law enforcement for years. He has served in various capacities, but is currently with the Albuquerque Police Department's Crisis Intervention Unit. And previously, he has served as a patrol officer, a crisis intervention detective, a school resource officer, and a negotiator on the crisis negotiation team. He is certified by the state of New Mexico as a master instructor in crisis intervention and de-escalation. And finally, we have Dr. The Department of Psychiatry at the University of New Mexico. She is a psychiatric epidemiologist and a mental health services researcher with extensive expertise in behavioral health disparities in rural communities and populations. And she has focused on improving justice-involved individuals with mental health issues for 20 years. So thanks so much to all of our presenters. And now I'm going to turn the presentation to Rosenbaum to kick us off. Neil?
Yes, thank you so much. So as she said, my name is Niels Rosenbaum. I'm a psychiatrist. I've been working with the Albuquerque Police Department for about almost 15 years. And as far as I know, I think I'm the only psychiatrist working full-time with the police department alongside detectives. And if that's not true, please let me know. because I'm always looking for colleagues to collaborate with. So before I move forward, I do want to make sure that this is about bringing psychiatric training to law enforcement in your community, literally. That's something we can do for you for free right after this slideshow, so you could join in our next meeting. What we do is we have online meetings twice a month now, and they were weekly. It's called the Crisis Intervention Team ECHO. ECHO is a model that was started in the University of New Mexico. It's a medical model. It stands for Extensions of Community Healthcare Outcomes. And so we adopted that for Crisis Intervention Team. We meet via Zoom, and we staff cases, and we give a lecture. And it's about bringing in experts and the community at large so you can get information out to everybody. But I'll talk about the details of the program later on. So the learning objectives: identifying the need for continuing education in law enforcement in the areas of mental health and substance use. Describe how the CIT ECHO is being used to train law enforcement and other safety personnel throughout the country. And describe the impact of this CIT ECHO on the knowledge of best practice and the ability to interact, the perceived ability to interact with people living with mental illness. So first, some background before we talk about the actual ECHO training. So going back to, say, the 1960s, when deinstitutionalization happened, that's when the people who were chronically mentally ill were in mental health hospitals, just long-term. That's where they lived. And with the discovery of medicines that help with psychosis, it became unethical to keep people in these institutions, so they were let out into the community. And for better or for worse, that's when police started coming into contact with them more frequently, and it's just been more and more as time has gone on. And when there are these occasional bad, very bad outcomes, these high-profile bad outcomes between police and those living with mental illness, there's usually a big call for training. And I think training is an excellent thing, and that's what our whole program is about. But most training is sort of one and done. It's a 40-hour class, and then you're blessed as a CIT expert, and you just go about your career. But what we want to do is sort of that medical model of ongoing training to keep up with best practices, to establish and maintain best practices in the field. So as we know, calls for service to police involving people living with mental illness is common. Various studies show the bulk of the studies show between 5 and 10% of all police calls are focused around mental health issues, which is an awful lot, and the time taken is about the same. What I find even as or more interesting is looking at it from the perspective of those living with serious mental illness. And serious mental illness is defined as anybody who has a diagnosis, and because of that diagnosis, they have significant impairment in their lives. They trouble with school, trouble getting a job, these kind of things. And it's about 5% of the adult population in the United States are living with a serious mental illness. And if you think about that, for every one of those people, they have at least 5 hopefully close relationships: parents, brothers, best friends. So this affects a tremendous amount of people. And of those people living with serious mental illness, 25% of them have been arrested, which is just a staggering number. And 12% of these folks, that's how they get into the mental health system, is through police. And that's not an ideal situation. Okay, here's some data from Albuquerque about behavioral health-related calls. As you can see, they've been going up. And the first year here is 2010. I actually started in 2007, so I'm literally off the chart. But I have noticed over the years calls going up, and it's becoming more and more prevalent. And the reason for that, I believe, is manifold. But one is probably the main thing is there's a bigger demand. As we get better as a department and as we have more services, people turn to us and they feel more comfortable calling us because the community has not caught up in terms of expanding their services. This is also just interesting. This is the similar data broken out by month. What I find interesting about this is if you look at December, it's actually a little bit lower. Most people think December is where everybody becomes suicidal and the holidays are miserable, but actually families generally rally around that population, and people do better during that time. What does cause upticks is the solstices, so the changes of season to spring and fall. Okay, so there is a need for specialized ongoing mental health training, as we know. Non-compliance can result in use of force, unfortunately. Training historically has focused on command and control, police training, and officer safety. So there was no specialized focused training on interactions with people living with mental illness. Obviously, that has changed dramatically. But there's still somewhat a lack of guidance and training on how to apply police tactics to people living with mental illness, because these have resulted in highly publicized uses of force. And what I'm meaning is there's not really an ongoing training. There's not a best practices that's updated and disseminated on a regular basis. And that's really what our program is about. It's trying to keep people up to date so they know how to continue their education and provide the best care possible. So the crisis intervention team model, for those who don't know, is the CIT programs are local initiatives designed to improve the way law enforcement and the community respond to people experiencing mental health crisis. They're built on strong partnerships between law enforcement and mental health provider agencies and individuals and families affected by mental illness. Really, the key thing here is this partnership. And if you can see this photo, it's a cop sitting down with somebody who's maybe homeless or living with a mental illness. And that's really the fundamental partnership, is between the police department and those people living with mental illness, and then the providers and the families. But it's really about establishing and maintaining those partnerships. And that's really what our ECHO program is about. It's about maintaining partnerships and growing them. Here's a quote from an article that we wrote. I wrote it with the chairman of the Department of Psychiatry and a detective. And as far as I know, this is a pretty prestigious psychiatric journal. It's probably the leading psychiatric journal in the world. And I think the detective is the only detective ever to be published in this, which I think is pretty cool. And the quote here is, CIT programs are born when law enforcement, their communities, and mental health professionals build partnerships. And that's really absolutely true. It's about partnerships and nurturing and maintaining them. And the maintenance is very important, especially in the police department, as there's a lot of turnover and partnerships can fall at the wayside as people change positions within the department. So here are the core elements as laid out in that paper and from our experience for the elements of a CIT program. Inclusive collaboration. So that's chosen very carefully, the words inclusive. It's in the collaboration that allows everybody at the table. And that can be messy and difficult, and sometimes working with certain groups and activists can be challenging, but it's very well worth it. And out of that collaboration grows like a beautiful flower, training and coordinated responses like mobile crisis teams, co-response teams, or dedicated detectives as we have in Albuquerque. And then what also grew out of this partnership is comprehensive training and the CIT ECHO, which we have. We work with the two largest hospitals in our city, and they supply psychiatrists for this program for free to help staff and teach about mental health issues. Okay, so now, as promised, start to talk about the actual CIT ECHO. So it's a Zoom meeting, and the only good thing that came out of COVID for us is that everybody now knows how to use Zoom. Before that, we had to spend a lot of time explaining it to them and going through dry runs with people, so people know, which is nice. And if you can see these different groups, there's the doctors and then the cops and then those people living with mental illness. And doctors and cops traditionally, especially psychiatrists, didn't always see eye to eye. cops are often didn't like psychiatrists because we represented someone that's just going to take away their guns and badges and label them as not fit for duty and that kind of stuff. And they speak very different languages. Cops speak, in 10 code, and doctors speak in Latin, and they just didn't see eye to eye. And so our training is about bringing those together, bringing these groups together, and we literally sit side by side in a hub group on these Zoom meetings where there's usually 2 or 3 psychiatrists in the room, detectives, and other people in a room. This is considered the hub of the meeting, and then people from all over the country tune in via Zoom, and we discuss cases, and we have active learning. So here's another visualization of what I'm talking about. There's a hub in the middle where there's the doctors and the cop, and these are considered experts in the field of mental health. And then first responders from all over the country, and honestly, all over the world. We've had people from Canada join us, log in, and we all learn from each other. Everybody in the network learns from each other. And there's also didactic teaching going out, so just a lecture going out from the hub. So the case-based learning is one of the key key components of the ECHO model. That's sort of its special sauce. So what we do is we talk about an actual case each time. So someone might bring up a case such as my neighbor is trying to plant chips in my brain, and he's put a force field around my house, and I really need help. And this is the case that a police officer says, we're dealing with this guy and we don't know what to do. We've gone out there 3 or 4 times. Do you have any advice? And that's what we do. We offer advice to people. And not only the hub gives advice, but everybody gives advice and everybody gives feedback. It's a really nice consultation. And consultations are great because, one, they're sort of a good way to reduce liability. And consultations are also great because it's best to do what's advised because that gives you the best outcome. The only downside for consultations is if you don't do what people suggest, sometimes you can get in trouble. So again, what is the CIT Clinic? There's a little picture of it. It's an online forum, and it has these 2 parts. The didactic, which is just, we give talks on pretty much anything that has to do with mental health and police work. So we'll have talks on just bipolar, and then we'll have a question and answer after that, and then we'll staff a case. Really what it's all about is raising the level of care between police, raising the level of competence between police and those living with mental illness, and giving access to experts and doctors to officers all over the country. And the other thing that's really important is it's free. It's absolutely free. Anybody who's in first responder can join. You guys, anybody listening to this can join our next meeting, listen to the didactic, and even bring a case forward and say, I have this hard case, and it would be great to get some feedback on it. And that's really what this program is about, and we're trying to establish and maintain and increase best practices. So I'm going to turn this over to Lawrence now. Thank you, guys.
Okay. Thank you, Niels. So what Niels has said is completely right. I mean, it has helped our department so much. I can tell you that I'm in charge of our enhanced crisis intervention team training, and it just gives me another way to get my officers a little bit more training. So you can see that for the curriculum, we have 7 modules. And so we break up our didactics under these models, and we try to get guest speakers to come in that are subject matter experts on whatever module we're working on. And they come in and do that didactic. And so you can see it's broken down into the different areas that we cover, which is CIT policing, and that can be anything from active listening to just the collaborations that we do. We'll also have psychiatric diagnoses, and that's important when we can get it also helps build that collaboration because we're getting doctors from the different hospitals, the different places within the city to come in, and it gives face time to them, to the other officers and people within the state so that they can reach out to them. We cover substance abuse a lot. it's a big problem here in Albuquerque and in New Mexico, so it's been well received by the different agencies that they can get any kind of substance use disorder type training. De-escalation and communication, and this has been kind of like a hot button lately. Lots of places want this kind of training. I can tell you that my unit alone, we don't just train police officers. We've trained 911 operators, corrections officers. I think the Albuquerque library system asked us to come in and teach it. So it's this is just another way that we stay on that edge and bring the best practices every week so that we can teach our ECITs more about that. Officer self-care has come up a lot. We've tried to concentrate on that a lot more just because we're noticing trends that, I mean, I don't know if people realize this, but more officers are likely to take their own life than to have someone take theirs. So we've kind of put that to the forefront and tried to push it. Resources is really important. That's another one where we can invite people from the community in to teach and to exactly say what they have. I think a couple weeks ago we had somebody that came in from the New Mexico Brain Injury Alliance, and they just had so much to offer, and we got so much feedback afterwards that people had no idea that all the resources that this lady had were there. So that's good. Special trainings, we've had people come in from like our negotiation team and teach like high element suicides, how to talk people off of buildings or on bridges, how to talk to people that are barricaded. So we've been able to offer all of that, and that's training that people wouldn't be able to get. Now that we have that hub and we have all those spokes, we're able to reach all over New Mexico. So if you lived in Raton, New Mexico, chances of you getting advanced police training or mental health training, it's pretty tough. You can't get time off because, you're in a smaller department. You have to travel. It costs money. Well, this is a free way for them to get the training and for us to network. We used that network a while back. We had one of our hub doctors reach out to me and say, hey, do you know anybody that works in Raton, because we have somebody that we're going to be releasing, and we just want to know that she's going to be okay and that she has services there when they release her. And we were able to use those connections and make sure that lady did have something to go back to when she left. Okay, didactic curriculum continued. So we can talk about de-escalation and communication. We use the basics of the peer model and active listening skills and verbal judo just to get across to them different things that they have as their, that we can train them in to help them when someone's in crisis. I think that this is like a big sell for crisis intervention training now, because it's just a way to have that personable officer come to you and use these skills to show empathy and to de-escalate the whole situation, hopefully with no uses of force. Officer self-care, we're just trying to make sure that officers know that it's okay to not be okay, that they can reach out to different people within our department and out of our department and get help so that it makes them a better officer and it makes for a better quality of life for those officers. I think we've had a lot of attendance on all of our self-care didactics. Resources, Albuquerque is somewhat resource rich compared to the rest of New Mexico. So we're able to hit on that and try to show people that, hey, we can help here. We've got stuff in Albuquerque. Either they can model their own resource things like that, or they can send people to us. We've had NAMI come and do a didactic and a panel, and I think that one went over really well because people had no idea what NAMI was all about. And it's the National Alliance of Mental Illness for people that don't know that, but they have a very strong chapter in Albuquerque and in New Mexico, and we have partnered with them many times. And every time we partner with them, things go out well. When they teach at for our cadets and for our basic CIT class, and it always gets some of the best reviews in that they were able to meet with people that have lived experience, to family members, talk to them, and just it helps in our de-escalation training because the people on the NAMI panel will explain to them things that might work. We use APD's COAST team a lot. I happened to be here when we first started this out in like 2006, 2007. It's a crisis outreach and support team. And they've been able to, they're civilians that are able to work with the community, with the CIT unit, and with the police department to help lower level people get connected to services. They kind of help people navigate the system. You can tell if you were in a mental health crisis or any crisis, it would be very difficult to call, a service provider or, trying to get Social Security, all these different things. The COAST is able to help them, and we've had them come in and do a didactic. Special training, we've had special training on transgender. At least twice they've come in to help with us so that we can do better at communication. And then we've had things on mass killings and serial killing. Lots of stuff that you wouldn't think that some of these smaller departments would have access to. So what are the benefits to law enforcement? And I know that Dr. Rosenbaum touched on this. Number one, free. It is free. You don't have to travel to get it. It's there every other week. Certificates are given, and we've actually sent our curriculum up to the state, and they can get state credit hours for it, which are gold out here because it's so hard to get them. There's a decreasing variability in how people answer these calls, so you're more likely to have, a unified response. And then we're able to help identify areas that need improvement. We've had other departments come to us and say, wow, we changed our standard operating procedures because we were sitting on this didactic and it went well. Let's see, we've helped many different departments develop CIT programs that have started by coming into ECHO and then going from there. We have decreased liability because we have peer review, which is really good when you start talking about the case presentations. And then development of best practices. That's how we're developing them, is through this. I'm going to defer this to this next slide to Niels, if you're still on. He has a lot to do with the www.gocit.org, a lot more than I do.
Absolutely, happy to. Thanks, Lawrence. So this is a website. This is a nonprofit that we work with. It's the CIT Incorporated. So this is the website. It's GoCIT, and you can get a lot of information about CIT resources, and also you can learn how to log on, or I'll actually show you in the next couple slides how to request being part of this network, this ECHO network where we have the training. On the GoCIT, we have one that requests for the CIT ECHO. We also have all the slides. So every time someone gives a didactic, we record it. And so all the slides are available to whomever wants them. And past slides are available. So past didactics are recorded going back to 2016. And we have a lot of really cool lectures on there. So if anybody wanted to, they're usually best in the car. So you sit and listen in the car. There's also a blog on this website where people keep up to date with some of the mental health, police interaction stuff. Care cards are, I'll just quickly, these are cards that you can request. There's sort of plastic business size cards like that you keep in your wallet, and it has a picture of the person, and it says, I'm a person living with autism, and then on the back it gives little tips to the cop or the first responder, please speak slowly, please don't, I get frightened by loud noises, whatever it may be. And it's a card that the person living with the disability keeps with them and can hand to first responders so that they don't have to remember to articulate everything. We also have a podcast available on this website, or just through any podcast. It's called Ask a Doc, Ask a Cop, where we do have the lectures, and we also have other topics that we discuss. So that's a good way to listen to a lot of the trainings in the car or whatever that are from the CIT ECHO. And we also gather a lot of resources and guidelines around the country and position papers and just have them available at this website. And it's nice if you can go to the next slide, Luz. If you go to Google and you do GoCIT, it'll pop. It'll be the first thing. The second one is, which used to beat us out, is like a noodle place. I think it's Vietnamese noodles for GoCIT. So the podcast that we're particularly proud of, we take the lectures from the CIT ECHO, and we have those as the podcast. And we also have additional episodes where it's just either me or another guest talking to a detective about mental health issues. Some of the popular ones that we talked in depth about, bipolar, for example. I think that's been our most popular podcast. And again, this is free. Anybody is welcome to listen to get a sense of who we are and what we're teaching. You can go to the next slide. Lawrence? Yeah, great.
Yeah, I believe that this is where someone else takes over.
Good afternoon, everybody. It's Annette Crisanti, and I'm really happy to be talking about the evaluation of CIT ECHO. I've been working kind of side by side with the CIT ECHO Hub team, implementing CIT ECHO, and mostly responsible for collecting data to demonstrate its impact. And so what we implemented for our evaluation was kind of a mixed methods approach, which incorporated both the collection of quantitative data as well as qualitative data. With respect to the quantitative data, we collect both sort of feedback at the end of every session, at the end of every CIT ECHO session, that assesses or intends to assess the impact on knowledge related to the content presented in that weekly session. We also reached out to participants after they completed 3 or more sessions to assess their satisfaction with the technology and the curriculum and the impact on self-efficacy. When we first started doing this thing, Zoom was really kind of a foreign concept to most people, especially law enforcement. And so we were really concerned about whether or not they were adapting the technology or if that was a barrier to accessing this particular program. Now, of course, Zoom is sort of second nature to everybody. And then with respect to our qualitative data, what we did was we conducted semi-structured interviews with stakeholders, sort of higher up leadership within APD as well as within the Department of Psychiatry to obtain feedback about the face validity and really the practical utility of CIT ECHO. And so here's just some process data that we've collected since we started doing CIT ECHO from back in January 2017. And since we've started, we have, in terms of our participants, they've come from over 50+ agencies. Over almost 300 participants have participated, and we average about 25 participants per session. Those numbers really vary depending on the topic, of course. We've provided or delivered over 205 CIT ECHO sessions. As Dr. Rosenbaum mentioned, we were weekly for many years, and then just over the summer, we have gone to twice a month, but we will start going weekly again, I think, in the fall. And then we've also debriefed 51 calls for service. Here, this slide just shows some of the agencies that have participated in CIT ECHO, really from all over the country. And as Niels mentioned earlier, we also have people participate from as far as Canada. In terms of who's attending, the 60% of our participants are uniformed law enforcement, and that's really who our intended audience was originally when we started CIT ECHO. Over the years, though, we've had sort of interest from other first responders who've heard about CIT ECHO and wanted to join. So of course we opened that up to them. Once a month we have an open session so that other people can in fact join. Just like this slide provides a summary of sort of the impact of CIT ECHO, and it shows that CIT ECHO increases officers' confidence and comfort in interacting with people living with mental illness. And I'm going to show you some actual data, but I just thought it'd be helpful to give you kind of some summary points before we go into some of the data. We have found that CIT ECHO reduces stigma. CIT ECHO has shown to increase awareness of resources in the community. We've also demonstrated that it increases access to and knowledge about CIT best practices, and that we also found through our qualitative interviews that the technology was really kind of an effective and acceptable way to provide ongoing CIT training, and more so now than ever before, with Zoom being sort of second nature and common practice among a lot of people. So let's just see here. Some of the results that we found was that almost 90% of participants agreed that after participating in CIT ECHO, they felt comfortable interacting with people living with a mental illness. 80% of participants agreed that because of their participation that they were able to determine if a person living with mental illness who had committed a crime should be taken to jail or a hospital. We were really proud of all of these numbers in terms of just the change that it has on practices. 84% of participants agreed that because of their participation in CIT ECHO sessions, they are able to utilize verbal de-escalation techniques effectively. And 86% of participants agreed after participating in CIT ECHO that they know who to call for advice about how to interact with persons living with a mental illness. And that's really, comes from those sessions that we have and sharing resources. And really in every didactic, one of the objectives of the didactic is to present information in a particular area, but also to share resources for that particular area. So if we're presenting on people with TBI, then we also ask the presenter to provide resources for TBI. Similarly, if it's a person with autism or bipolar disorder, we always end the didactic by sharing resources for those particular illnesses. So here's some of the data that I promised I would actually show you. And this is sort of a retrospective, the question is sort of a retrospective pre-test, post-test, where at the end of every session, we ask people to kind of think about how they thought about a particular item before participating in CIT ECHO, and then how they thought about a particular item after they participated in CIT ECHO. And so this is a question that we ask. It is the job of law enforcement to link or connect people living with a mental illness into treatment. And people responded kind of before participating in CIT ECHO, law enforcement really didn't think it was their job so much. But after participating in CIT ECHO, we see a really strong sort of an increase in the number of strongly agree responses. So those responses are going in the right direction, increasing officers' knowledge that it really is part of their job to link or connect people living with mental illness into treatment, as long as we provide, the resources for them and help them know how to do that. All right, I think this is my last slide. These are just some statements that, some quotes, direct quotes that we took from the qualitative interviews that we did with key stakeholders, mostly leadership with an APD and sergeants, some lieutenants that have participated in CIT ECHO. And we had a lot of really great statements, but these 5 statements were ones that kind of resonate with me in terms of the impact that CIT ECHO is having. And so, for example, one officer reported, I leave every time tucking away a little bit like, oh yeah, there's a resource. I think having doctors in the room is a big deal. That's not something we have access to. The quote, with the largest quote, I will keep in mind that individuals with this disorder, and this disorder, they're referring to people with bipolar disorder, are very smart and can catch on to my reactions and behavior, even though the likelihood that things are happening as they say are probably not, is still very real and scary to them. So just that realization alone that a law enforcement officer sort of comes to after participating in CIT ECHO for us is just kind of saying that this has been well worth it. So I'll let you read the other two quotes for on your own, and I will forward to this next slide, and I'm going to turn it over to Dr. Gonzalez.
Hello, good afternoon, everyone. This is Dr. Martin Gonzalez. So after several years of working with CIT ECHO, and we look back and reflect on our wins and our challenges, we have some significant successes. And the big ones we've highlighted here, and two large ones, is that compared to the traditional one-time training that all law enforcement officers, APD, are required to take, this gives them access to ongoing specialty consultation, giving them advisement for difficult cases. Individuals in the community are having multiple calls for service, and they want new and different ways to think outside the box or find different ways to approach interactions with these individuals. And so our program provides these law enforcement officers with opportunities to learn and adapt their practices in the community. And then the didactic presentations and the cases debriefed by officers have resulted in changes to APD's mental health training and their approach to mental illness within the community and their partnerships with local mental health providers and community support systems. However, during the course of this, we have hit some road bumps. A big one is the misconception that CIT ECHO is the equivalent to the 40-hour CIT training course, and this is not an equivalent and is not meant to substitute that. As Detective Saavedra pointed out, that the 40-hour course is a very intensive, focused course, and the CIT ECHO model is a ongoing continuation of education and training that is adaptable and can be focused, can be more general, and we can tailor fit it to the needs of the requesting officers, to sync didactics with case presentations and things like that. Like Dr. Rosenbaum had mentioned, there was a major language barrier, especially initially, right? We had to learn how to talk to each other. And I think that caused some hesitation and some anxiety from both sides of the table. And when we have these anxieties, as professionals, we kind of default back into our comfort zones and use that regular jargon that we're used to communicating with our friends and colleagues. So finding a commonality in language and how we describe situations, because often we can describe the same situation using very different languages and not really appreciate how we're describing very similar things, and that can lead to misunderstandings and kind of interfere with collaboration. And then also the hesitation about video conferencing, which is no longer an issue and is one of the positive artifacts of COVID-19. Is everyone has had a crash course in using telecommunications and video technologies and things like that, and we're going to bank on this and use this as a opportunity to grow the program and extend our reach into other communities and work with other police departments and other law enforcement entities throughout the country and even internationally. So where do you want to take this in the future? And this has been a hot topic conversation, particularly over the last several months with all the social unrest that we're seeing in our communities, the calls for defunding the police, which causes a lot of emotional response and a lot of heated conversation. And this is something that I think we have to take an approach that's very pragmatic and really appreciate where all the stakeholders are coming from. And the nice thing about Albuquerque and Albuquerque's police department is we have been ahead of the curve for the past few years. And one of these programs that has resulted of us being ahead of the curve and being front runners in police reform and community policing changing is the implementation and the creation of the Albuquerque Community Safety Department. And so again, this is a program that resulted after a few years of collaboration between leaderships both at the department and local county and city government, where the idea is when calls for service are received by the dispatch center, they are then triaged, assessed for priority, and then the appropriate personnel and resources are dispatched to these calls. And the idea is that law enforcement isn't necessarily the best option for some situations, and that could relieve the burden from law enforcement officers so they can focus more on their traditional roles. And then we can find other professional individuals that can partner with law enforcement, either co-respond or respond separately to these crisis calls. And this is a way for the department and the community to focus more on the public health aspect of a crisis situation while keeping public safety in mind. And this has been the overarching goal of CIT ECHO since its inception, so that we can, one, improve the outcomes of our clients and our community members, and then reduce incarceration, because as we're all well aware, if an individual, especially one with mental illness, gets wrapped up in the criminal justice system for a variety of reasons, it's very hard for them to pull out of that. And that can cause a lot of barriers for their ability to do well and function and participate in the community. And then we want to continue leading the charge and being at the forefront of developing police reforms and leading the development and research and best practices for working with the individuals with mental illness and partnering with our local mental health providers and community resources. And these are some of our ongoing collaborations, just to name a few. And these are the teams that we work with most frequently in the past few years. But we're always looking to build relationships with new organizations, new community advocacy groups, and find a way to integrate their knowledge base and their connections into our training, so everyone kind of benefits from this. So some of the groups that have been mentioned before is the National Alliance of Mental Illness, and we have them speak and give didactics to our CIT ECHO meetings quite frequently. Another one that we reach out to frequently is the Transgender Resource Center of New Mexico, and this organization provides a robust menu of resources and services to our transgender community members throughout the city. We've also partnered with New Mexico Disability Rights, the VA Justice Outreach, Albuquerque Healthcare for the Homeless, because as we all know, many of our citizens who have mental illness are also struggling with homelessness, and by partnering with Healthcare for the Homeless, we can identify and provide those resources to these individuals when they need them. Another homeless program is the Albuquerque Street Connect, and then Adult Protective Services, and collaborating in ways that we can protect and provide services to our elder and most vulnerable individuals in the community. The CIT ECHO has been a bright spot for APD and New Mexico because of its collaborations throughout multiple law enforcement agencies, its relationships with the University of New Mexico Health Sciences Center, particularly the Department of Psychiatry. As part of the resident training for psychiatrists going through our program, there is opportunities to both participate in the CIT ECHO sessions where they can present a didactic, teach on a topic of interest, staff cases, and then there's also opportunities, and this was prior to COVID, and we had to adapt, of course, but psychiatric residents were going out with CIT detectives and clinicians doing home visits, doing in-the-field evaluations, determining the need for resources and how to connect people, and sometimes doing emergent psychiatric evaluations and getting people transported to emergency psychiatric services for stabilization and treatment. And these are our ongoing collaborations and partnerships that we want to continue and grow in order to benefit all of our citizens within the city. And so to reach out to any of us with any questions that we don't get to later in our Q&A session today, feel free to contact any one of us via email or go to the website to gocit.org where you can get your questions answered or get connected to any resources that you may need. Some of our sources cited during today's presentation. And so that's our presentation for today, and I'll turn this back over to our pilot here.
All right, thank you so much. Okay, so that was a wonderful presentation, and we have just a few minutes to cover maybe one or two questions before we jump over to the Adobe Connect platform for our more in-depth discussion group. And so one thing I do want to clarify for our listeners, someone asked what entity heads this up. And so if one of you among the presenters would just clarify, who created CIT ECHO, who is running this program, and maybe explain a little bit more about how that has been connected with the Albuquerque Police Department.
Sure. This is Niels Rosenbaum, a detective, and I, more than 5 years ago, were asked to do a presentation for the ECHO at the university. This is before CIT ECHO existed, just about de-escalation and working with police. And from there, we met with one of the psychiatrists from the university who was running the ECHO program. ECHO is a very, very successful university program for medical. And so we teamed up with them and developed together this program. So it's a partnership between the university, the Department of Psychiatry, and the Albuquerque Police Department. And that's how it's been from the beginning.
Okay, thank you. That's helpful. I think so. Do any of the other presenters want to add to that?
This is Annette Crisanti, and I'll add just a little more background information for people who might be wondering how it's been funded, because I know that's always a big question that we get. And so originally it was funded through a grant from the Department of Justice through the collaboration between mental illness and criminal justice system. And that was a 3-year grant. Because of its success, we were able to convince the state of New Mexico through the legislature to continue funding it, as well as the Albuquerque Police Department provides funding for the program coordinator position. And the Department of Psychiatry provides some funding to support my role as evaluator, as well as Dr. Gonzalez's role as one of the psychiatrists. And so it's kind of been a coming together of funds from different sources to continue its implementation beyond the original grant that we received for it. But we've been going strong now for several years, and I think just because of the impact that we've been able to show on law enforcement, sort of their increase in knowledge and impact on self-efficacy and understanding and increase in awareness of resources, that we've always been able to continue funding it.
Thank you so much. And I think maybe we have time for one more question. Someone was asking about confidentiality concerns. So being able to join in to these calls and talk about cases, are there any HIPAA or confidentiality issues with inviting anyone to listen to the calls where cases are staffed?
Yeah, sure, I can look at that. But this is Niels Rosenbaum. There were a couple things. One, when we had a grant, we were under research, so everything was held to very high confidentiality standards. But the police are not covered entities. And when the psychiatrist, so that means that they can share information about anything with anybody. The doctors, if they know the patient, which sometimes happens, they don't act as if they know the patient. They don't respond in that way. So it's the doctors on the panel who are covered by HIPAA, and they don't share any information. They just give advice. So in that sense, we're not really HIPAA protected. But we do take precautions with confidentiality. So we will, if we have larger or open sessions, we present a case, we hide some of the details. We don't use the name. But in the smaller sessions where it's really just cops and other first responders, we'll talk about the patients by name.
Okay, thank you. Any other comments on that from the other panelists? Okay, and here, I promise this is the last question we cover before we go to discussion, but we've had a couple of questions come up about involving people with lived experience in these case discussions and in these trainings. So do you involve people with lived experience of mental health, substance use issues, or justice involvement?
This is Annette. I can jump in, and then I think I'll ask Niels to also address this question. But absolutely, over the several years of us doing CIT ECHO, we've often had people with lived experience come and tell us, sort of the audience, the participants, their story, you know, their experience with law enforcement, some good stories, you know, kind of what some of the officers did that worked well for them, and some not so good sort of experiences in terms of what didn't go so well. And really, I think we were all able to learn, you know, so much from the sharing of those stories. And then more recently, there was an organization, People with Lived Experience, that do an ECHO program within our jail that also came and presented some of the work that they're doing around, you know, kind of helping inmates better sort of detection of their physical illnesses. And Niels, do you want to kind of add on that?
Yeah, I think you got most of it. Yeah, we are very inclusive in our collaboration, obviously. So we do have speakers who have lived experience, and we encourage that. And some of those have been our best didactics, our best trainings. So yeah, we're very welcoming, and they have been people with lived experience have been integrated into the program from the beginning, really.
All right, thank you for that. Okay, so we can continue the discussion about that topic, people with lived experience, or a variety of other topics. There are many other questions that were submitted that we will be moving over to our discussion group for today's webinar. Because this is likely to be a smaller group, we do have a different platform. You can join by following this link. And if you look in the chat box, there is a clickable link, if that's easier. So you can just click on the prainc.adobeconnect.com/CRDG/, and that should take you to our platform where we will be continuing the conversation with our 4 panelists. So we hope that you join us there. If not, thank you so much for joining us today here, and I really appreciate so much the presentation from our presenters today about this fabulous program. And so we will be adjourning now, and hopefully you can join us for the discussion group over in the Adobe Connect room.